Guys, we're in the middle of a pandemic and these are trying times. It's hard on our mental health, our mental state, and this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees.
COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Quadcast Nation, welcome back. 'Tis the holiday season. It's the Omicron season, and I decided to do this Solocast basically because I feel like I got a lot on my chest, and I might be a little bit disinhibited being post-call, but there's so much out there that's making me, for lack of a better word, pissed in regards to COVID. This is my show. I'm going off a little bit. And the reason, one of the main themes is like, we don't seem to learn. Okay. Like I'm recording this December 21st, 2021. We are almost 2 years into this pandemic, and I feel like we are not learning. We are not trying. We're approaching the same problems the same ways and expecting different results in a non-sustainable manner and not acknowledging what the repercussions of our actions can be or have shown to be, and how myopic our thinking has been, single-focused, and not acknowledging the unintended consequences of our actions. So, today, as I mentioned, Quebec, they're doing some form of lockdown. My kids, all these kids are being told, bring your stuff home. Looks like you're going to be doing online learning in the new year. And there's no end in sight. There is end in sight potentially, but we're acting like there's no end in sight. And this is not sustainable. So here, I just wanted to put together just a few thoughts that I have in general, lessons from COVID, things that we need to rethink so that we can have a more sustainable outlook on things. Number one, I want our leaders to lead. I want them to stop instilling fear. I want them to instill confidence. I want them to tell us that we can get through this. We will get through this. There is an end in sight, and I want them to think about how to create that end in sight. Enough of this, we got to do this more restriction. We got to do this. This is Omicron's coming. We don't know. We got to just be fearful of the unknown. You know what? We're 2 years into this. Yes, there's some stuff about Omicron we don't know, but we know a lot about this pandemic. We know who gets the sickest. We know that vaccines work at reducing hospitalizations and deaths. We know what populations are most prone to getting sick. We know metabolic disease matters. You know what I'm saying? So use this stuff to our advantage. Let's be more strategic, but at the same time, instilling some confidence. Let's communicate better. Let us come up with clear, concise messaging that doesn't confuse the public. Like the fact that the vaccine efficacy is confusing to many is on us. Yes, you get triple vaxxed, you got your booster, you can still swab positive. Yes, But are you likely to land in hospital? No. You've significantly reduced your chances of landing in hospital. That's the message. Simple. That's the message. You know what I'm saying? And like all this confusion, all this stuff, all it does is breed more garbage to anti-vax sentiment. And I'll say this other thing, the way we approach the communication and regarding vaccines, I want us to think that it's not just COVID-19 vaccines. It is vaccines forevermore. We have to instill confidence. We have to be upfront about what we know and what we don't know. Because if we aren't honest, that's used as fuel. Be like, remember what they were telling us about that vaccine back in the day? And now they got this other one? No way I'm taking that, even though it's going to save thousands of lives. You know what I'm saying? This is why honest, concise communication is essential. And we need to be doing a better job of that. Next, I want to talk about risk assessment. This is another thing we've done a poor job at communicating. The fact that you still see 23-year-old healthy people scared for their lives relative, like from COVID. And we know, once again, what those risk factors are. So, and the reason I also think this is important, so people can make decisions for themselves. You know, people that, you know, it's holiday season and they're like, oh, can we get together? Well, even though we're a small group and I'm fully vaxxed, I'm triple vaxxed. Like, you need to know yourself, ask yourself, what is the risk to my family? I don't think we've done a great job at articulating that. You know, if you're 83, you got type 2 diabetes, you got 2 doses, no booster. That's a lot different than the 23-year-old we just talked about. And you can make a more informed decision and a less fearful one, because you know what the data is telling you. I think this is another thing that we got to think about moving forward. Next, I want to talk about models. For crying out loud, can someone tell me when these models, these projections have been accurate? Tell me about this. Like, and the fact that we base our policy on the projections, you know, it's not helpful. Like, we need to be using real world empiric data. That should be the focus. What is happening to places that are 2 weeks ahead of us, 3 weeks ahead of us, a month ahead of us? What's happening in Denmark? What's happening in the UK? What's happening in South Africa? This is where a lot of the answers lie. You know what I'm saying? When I'm not going to say who comes on a microphone saying, yo, watch out, we could get up to 20,000 cases if we let things rip, 20,000 cases in ICU. I'm like, that's not even logical. This is someone that we're putting in front of a mic, a leader, an expert, that's letting it rain on media, 20,000 ICU cases in the fourth wave. God damn it. Like, and you wonder why people are nervous, anxious, fearful. You gotta keep it real, man. Like, I don't want to go too far off on this one. But it goes back to even our decision making. I do think a lot of the decision makers we've made throughout this pandemic is not necessarily data driven, but it's fear driven. What if this? What if that? But what is the data telling us? The data has been reassuring. Like, I put a post recently on the latest Denmark Omicron data, which has been reassuring. And yes, it's early to be absolutely certain of anything. But it's more information to let us know that maybe we are seeing less severe disease with Omicron. Like, they currently have less than 5 Omicron cases in their ICU. Like, that's a win so far. And, you know, I just really think when it comes to future decision-making, we really needed to have come less of that fear lens and more of a data-driven lens. And so we could come out with better outcomes. You've heard me say this before too, but I'd be remiss not to mention having a holistic approach. I talk about being in ICU. The nature of our job is we got to look at things in a holistic manner. You got to tell, I can't ignore the kidney. I can't ignore the lungs. I got to look at things in a holistic way, because every move affects another organ or another part of the body. And so I got to ask myself, what's going to lead you to your goal of being functional, or to whatever your goal is? Like, this is the question. And this is what the best course of action is. So if you lock down, how's that affecting the economy? How's that affecting marginalized community? How's that affecting education? How's that affecting cancer screening? How's it affecting mental health? You can't ignore this shit, because all that is health. And if the end result is worsening of your citizens, or your overall well-being, or overall health of your population, you got to rejig your approach. You got to look at things again. You got to pivot. You know what I'm saying? Holistic. Stop with the myopic lens. You know what I'm saying? The other thing I want to talk about, we need to be able to openly communicate. Stop always looking for that black and white approach. One of the things I think it was, at one point taboo to mention was that whole, like, does natural immunity matter, for example? I mean, I might get canceled for saying this, but think about, if we acknowledge natural immunity, think about how much things would change. Workforce, I'll tell you, and keep this in mind, I'm triple vaxxed, okay? But the people that came to me to say that, hey, I don't know about getting my vax because I've already had COVID. It seems like I'm well protected. Like, do I really need this? In Europe, legit, they were being acknowledged having a natural infection. If you had a documented infection within 6 months, you would be part of your immunity passport. Same thing here. Like, why would we not acknowledge that? And I'll tell you this much. Have I seen double vax, triple vax patients land in ICU? Luckily, much less than unvaccinated people. But I'll say this, I've yet to see somebody with a reinfection in ICU. So the data supports that. A lot of data I've seen supporting that natural immunity is strong. And I can't believe I have to say this. That doesn't mean go get COVID. You know what I mean? That's not what I'm saying. I'm just saying those that have received it seem to have a strong level of immunity from what the data I've seen and from my clinical experience. But yes, I think early in the pandemic, it was taboo to speak about specific topics. And this is not serving us well. We need to be able to have an open dialogue about these things. Can't be canceled for bringing up things like myocarditis. Like, these are people's lives. And by having that open dialogue, lives can be saved. And I mean, part of this is because I feel like the world's being run by Twitter right now, which is like the devil, by the way. Twitter equals devil. You know what I'm saying? I'm horns. Yeah, and it's just meant to have that really create that animosity. It really promotes partisanship, and it's just battle after battle. I think if you were have a colleague that you were having a legit disagreement with, if you picked up the phone and called them and chatted about it, you're much more likely to be civil and much more likely to find a lot of more common ground than you think, compared to trying to bust that out in 247 characters or whatever it is these days.
We know COVID has been long and hard, but we can do something amazing together during this holiday season. I'm Kevin Crowe, founder of Give a Mile, and we provide flights for people to be together that are dealing with palliative or critical care. Flights for mothers, fathers, sons, sisters, daughters. And this holiday season, we're looking to give 40 incredible gifts of flights away from November 1st to January 1st. And this is where we need your help. We want to get connected to families that could use these flights. So if you know of a family that could use this incredible gift, please email us at info@giveamile.org. That's info@giveamile.org. And to find out more about Give a Mile, go to giveamile.org. Let's make this holiday season an incredible one of joy.
A couple other lessons here that we need to think about. Hospital capacity. Can you believe, like, I'm in Ontario, hospital went to its knee, or the society went to its knees for 900 ICU patients with COVID in a province of 15 million. Like, we really need this pandemic, future pandemic, to be able to ramp up capacity and really create that wiggle room for if something catastrophic, if and when another catastrophic event happens. And we could have been working on this throughout this pandemic, creating more capacity. And I hope this is something that we take seriously. Other lesson here: stop fucking up our youth. Stop it. Taking away their activities, taking away their schooling, giving them no outs for managing their stressors. They have no funding for seeing a psychologist, for example. Like, so our Bridges Over Barrier, we had a meeting in early December, and our frontline social workers are screaming at us saying, yo, the kids are struggling. They have never seen something like this. It's the next epidemic. Like, it's serious, man. It's our kids. And what are we doing about it? What are we talking about it? Are we investing in it? Are we providing them with help? You know, we set up a meeting next week to try and, or next month, with hopefully some people that could create some change to talk about. We need to obviously change how we provide mental health to our kids, because our current formula, there's not enough resources. There's not enough person power. We can't do it. So how are we going to approach this bad boy? We need to think about this. The other thing in this pandemic, I'm surprised, like, I hope we learn, is when we have wins, when we have positives, we got to take advantage of it. The fact that our kids much less likely to get sick before Omicron anyway, much less likely to transmit. Using the outdoor spaces, you've been using rapid antigen testing. Like, those that follow me on the show, I've been busting this out since, I want to say, April, May of 2020. Why aren't we using rapid antigen testing? Didn't make sense. Oh, they're not as good as PCR. We want something more sensitive. So what avenue can we use them to really take advantage of it, where you could get results in 15 minutes? We could use serial testing to really make sure that people could come in safely. I'll tell you right now, especially when you think about human resources in Omicron, you want to staff your ICU, you want to staff your hospital, you better be thinking of creative solutions. You know what I mean? We're in a state now, you can't wait for a PCR. You can't. It's like the system is flooded. They're drowning. And so I mean, the short version is, I can't believe it. We waited this long to utilize these things. Last couple of thoughts. We need to, our leaders, our media, our people that have like a platform, we need to be talking about an end game. We need to talk about how to achieve that end game. We need a framework that if future variants come, we can handle it and maintain normal life. And this is going to take out of the box thinking. Stop approaching things, as I mentioned, in the same way, and expecting different results. Like, I get a lot of questions. I brought this up on Twitter, and they're like, "Oh, Kwadwo, if you want us to stop approaching things the same way, what are some of your ideas for solutions?" And, you know, it's a fair question. And my answer is intervene. Think of interventions as a tool instead of restrictions. Where are we seeing COVID? Where are the patients that are most likely to land in ICU, and how are we going to intervene? Are we bringing vaccines to the underserved community? Are we bringing boosters to those that are high risk? Are we making sure they have access to rapid tests? Are we going to offer them therapeutics that have been deemed effective? Like you've heard how many times about the oral medications that reduce hospitalizations. What about fluoxamine? Great study. I believe it was in the Lancet, reducing hospitalizations, outpatient interventions that will prevent people from landing in hospital. Why aren't we providing that? Why don't we provide that upon testing? Hey, you test positive, we will bring these therapeutics to you. Monoclonal antibodies. You just saw, we had a show with Zane Chagla, reducing your risk of hospitalizations. You know, there's, I don't know how many clinics there are in the country, but certainly to look at the ones that are doing it well, we got it in Hamilton. You know, this ain't global. And so, like, innovate, think outside the box, intervene, bring interventions to the people that need it the most, protect our hospitals, and allow us to get through this. Outside the box thinking. You know what I'm saying? And, don't get me wrong, I ain't no expert in any of this business. I'm by no means an expert, but I know when things ain't working well. You know, and one of the makes you a strong clinician is when you need to realize what you're doing is not working or is having some significant negative impacts. So let's pivot. Let's think outside the box. Let's think of a solution that we could create some win-wins. And I'm not hearing enough dialogue about this. How are we creating win-wins? How are we creating something more sustainable? And and allowing people to have that dialogue and not get canceled. That's what we need more of moving forward. Anyways, people, thank you for letting me go off. Follow us on Instagram, YouTube, TikTok now. Craziness. Instagram, Facebook at Kwadcast. Leave any messages or comments at kwadcast99@gmail.com. If you haven't jumped on Solving Wellness, the community is growing and it's growing strong. Solving Wellness is a way of reducing burnout amongst healthcare providers, and we're going to do it. We're going to do our part. And we want to give a shout out to our team, Sarah, Julia and company that really have made that magic work. Yeah, I just really want to give love to everyone that's been supporting the show. I'm not sure if this is going to come out before the holidays, but if it is, happy holidays. We love you and stay safe.